transformed health data research, what we can all as data users learn from that, and also the kind of things that happens when we don't actually have complete data and some of the decision problems that that creates. My guest is Caroline Cake. She is CEO of Health Data Research UK. Caroline, welcome to the show. Can you just say hi and tell us a little bit about what HDR UK does?
Thanks, Andy. Hi, I'm Caroline Cake, as you said, and HDR UK is Health Data Research UK. What we do is we're the national institute in the UK for health data science. And so what we do is really work with people who are health data scientists, helping them ensure they've got the data they need to do the research, that we've got the right quality of data, and that we've got great research coming out of using healthcare data.
Fantastic. Now, so clearly great institution helping people across the UK or researchers across the UK. And the last 12 months have been transformative for the world, but also your work. And, one of the reasons we wanted to bring you on the show is to explore some of these ideas. Can you tell us a little bit about how, obviously the pandemic has been a terrible situation for the last 12 months, but it has transformed health data research, transformed your organization, and taught us all lessons about how we can use and integrate data. Do you want to give us, some of the highlights of that from a research perspective?
Yeah, I mean, it's huge amounts have come out of using health data over this year. So if you think just across in terms of the data itself, the types of data being generated, we've got new forms of data coming out in terms of symptom trackers, in terms of the kind of data associated with testing data that previously we didn't have. We've got different attitudes to how data is being used, so different members of public communities, different groups engaged in the research that's being used and how data should be used on that. We've got new forms of data being brought together and being linked together, so that's been happened for the first time on that. So really the scale of, and then really the kind of collaborative effort across all sorts of scientific disciplines and different different areas and fields coming together to really help answer this massive question, not just clearly for the UK, but internationally. And I think that scale of everything coming together has been incredibly powerful.
Yeah, each one of those is incredible. I mean, talk about symptom tracking, right? 18 months ago, could we have said to a nation, can you all start logging onto an app and tracking your symptoms? That's always probably been a dream of health practitioners, but it took a transformation to happen, right? And then attitudes. I think that there's more there probably, isn't there, about how people, how do the public understand health data? How do you think they've responded to the way the health data research community is working?
Well, I think it's really, I think prior to this, perhaps there might be I might be potentially a bit of a patronizing view as to what the public know and what they don't know, and what people can do. Whereas actually, if your average person now, their knowledge of health data, and just through listening to the news over the last year, the kind of knowledge of how data is being used, how decisions are being made, really has transformed, and really there is a huge depth of knowledge in across the UK and members of the public, and I think that understanding has really shown. Very important from COVID point of view, but I think we shouldn't ever assume that the public don't understand or don't know. Actually, some of the most sophisticated conversations come from people who've just been observing across different areas. And sometimes perhaps if you're too deep in one field, you perhaps don't see the more kind of aspects across there. So we've certainly found by involving our public and patient and members in decision making, they'll pick up things or they'll think about things differently in a much more nuanced way. So I think that level of knowledge has then really helped us get better science and get better ways of thinking about things.
That's it. I mean, that's something I always, whenever we have new colleagues join our company, join Tableau, I'm always like, you are the best employee to have right now because you have the joy of naivety, right? So it's not a lack of intelligence; it's a lack of not being saddled with the inertia
or the legacy issues, all the different aspects in there. Yeah,
absolutely. And I know you've done some surveys with the public, which gave you some surprising and astounding insights as well. Is that right?
Yeah, so we had, and it's again a number of ways we've been using public. So we've used, terrible term, but involved and worked with members of the public. So there have been certain points in terms of helping getting views from members of the public in terms of what research questions should be being asked and worked on. So if you can imagine, there's an infinite number of different ways and questions you could be asking. But what's been helpful to have is members of the public actually helping us prioritize and taking a view of actually what matters to people most. So we've had that a number of stages through the process, kind of most right back from the start, when we had a really kind of wide different areas to vaccine aspects and what matters to people through that. But also in some more real, very specific areas. So, example, when we're been doing work around clinical trials and having data flows to support recruitment, asking members of the public their perception of how they would feel if they were called, having used their data to identify suitable people, how would they feel about that and what would their responses be? So that has been a really invaluable perspective. But then also to do it in reality, and then to see when we actually do it, do we get the same response? So people's perceptions of what they might feel are quite different to what they then perhaps how they behave in reality when the actual situation happens. So I think having those, that's been a really valuable part of it. So for example, when we were doing the trial side, there were some concerns beforehand from members of the public perceived that there may be worries about being approached. When we found when we actually did it, when we went approached across several thousand people, there were no concerns in the kind of from members of the public. So it can sometimes be different in terms of what actually happens in practice.
Do you think part of that engagement is also because obviously the issue is much more real, and it more directly affects all of us because the disease is kind of everywhere at the moment? Do you think the proximity to the reality of COVID has also assisted that there?
Yes, certainly. I mean, for all of us, it has to be in terms of when you know how it's going to affect your parents or your grandparents, your aunt. You want to be moving things forward, and if there is a way of getting out of the situation that we're in at the moment, people are much more willing to do that, and therefore the immediate benefits are so much more obvious than perhaps they are in a slightly more kind of distant or something you're not quite so directly connected to. So yes, I think it's help move through. But what I think is going to be quite powerful about that is we then have that case example that then shows this is what actually happened in practice, and we can actually show. And one of the things that's going to be important for all of us in this field is to be capturing the lessons as we go through, because it'll be very quick. It'll be very easy in a few years' time to kind of go, well, actually, what did actually happen? Because things are happening so fast, it's very easy to kind of forget the thread of exactly what happened when and what was required. So I think one of the important things for us to be doing is to be capturing the lessons as we're going through it.
And that's a general lesson in any business, isn't it? Review and learn. Do you feel like you have the time to do that? I confess I haven't had time to review most of what I've done in the last year for measuring impact.
I think it's one of those things that I would have said no until I started doing it and realizing quite how powerful it was. So I think actually in doing writing up papers and things like that, and starting to kind of actually forcing yourself to actually reflect on what actually did happen, then it then enables you to be much more effective in the next piece you're doing. So I think it is kind of partly our kind of duty and responsibility to be doing that at the moment. So I'm strongly encouraging all my colleagues to be really working on capture it now, because it just won't be obvious in 3 months. You won't remember in 3 months' time what actually happened.
Absolutely. And you talked about the way speed has transformed things. Obviously science is getting published more faster. It seems like all the red tape has just fallen away. And story or research is getting to the news where I might read it a lot quicker. Is that just a glorious change, or is it tinged with a bit of some disadvantages as well? How's that changed?
Well, I suppose the preprints have been a really kind of powerful component of getting things out quickly and early on that. The thing you lose in that is that peer review, which is a very important part of actually developing and improving things from there. So I think there are real benefits to the preprints, but I think to then say, well, it would be quite dangerous then to lose the rigor and kind of really good disciplines. And I'm not a scientist by background, but this is me observing and looking at the process and going, that would be a big loss if you weren't to be really rigorously peer reviewing aspects, because the preprints, anyone can put something out. So it's just like, how do you filter in from that what's actually useful and what works and what doesn't work and things in there. So there is clearly an important component of doing that. But that said, in the pace of things, as well as that sort of how reviews and things are coming out, and papers coming out. There's also the pace actually of galvanizing everyone behind a common effort and approach has helped to overcome different areas. The clarity around prioritization, so groups coming together, be it SAGE, be it different aspects associated that Patrick Vallance has been leading on at National Core Studies Programme, that then gives a sense of priority that then allows very willing people who've always been willing and keen to do things, but to actually get on board and work together on something, which then makes things move a lot faster.
That's interesting. So the next question I was going to ask about is advice around, a business audience who are trying to create better data cultures. And I think it's interesting how, when everybody's working together to one objective, we're all sailing in the same direction. And often in business, everyone's got their own objectives. So clarifying those. Are there any other lessons from last year that do you think for people who are using data and trying to transform their organization, what other lessons have you learned from the last year that might help?
Yeah, I suppose, yes, the obvious one of having, never waste a good crisis and things in there is that kind of obvious message on there. The drawing on what's already there and what's already existing. So we've really benefited. We have a fantastic network across the UK of all sorts of different organisations. By being able to draw them together, we were really rapidly able to actually pull masses of data together, lots of different perspectives. And so I think drawing on what's there already and giving everyone a role within that, then the very nature of data is that you can aggregate up quite fast across different areas. So that was incredibly powerful. Had we started from scratch, we really wouldn't have been anywhere near where we would kind of trying to or try to come up one single solution that works for everything. That really wouldn't have been terribly helpful. So I think it's very easy to spend time in terms of theoretically coming up with the perfect solution, whereas actually coming up with an approach that can actually adopt, plug in, and scale up across a lot of existing things that then draw on the talents, the expertise, the knowledge, and then being able to link things together. That's where the real power came through on the data side on that. But then also having a story and a narrative that holds all the different components together is very important.
Yeah, I like that. I always focus on storytelling. It's a great means to persuade people to change. Now, one of the reasons we originally started this conversation behind the scenes was that you wrote a letter to the Economist, which was published back in December. We're doing an article on how patchy data hampers efforts to tackle inequalities, and as your letter pointed out, agreement with that, but also similar problems that you see in academic research about how the missing data is actually more important than the data you have. And I thought that was fascinating. So did you want to elaborate a little bit on the motivations behind the letter and what may be potential solutions?
Yeah, and this is around actually if we're going to do great science, we need to, and we're going to use health data to do great science, we need to have data that represents all of us. Otherwise, we're creating algorithms or approaches that work for one subset of society but don't work for others, and in fact in some cases could actually be downright dangerous for others, be it and the obvious aspects in terms would be ethnicity differences in there, but you've also got age differences. What works for a child is quite different to what works for an adult male. So in terms of thinking through how we create better outcomes, if our objective is to enable discoveries that improve people's lives, well, let's make sure we are improving everybody's life and lives in this, and rather than actually just a subset of society. So I think that's seeing it as being a better outcome and absolutely fundamental to doing great science is almost a starting point on that. That's around, so the data is a core component of it, but it's also who's doing the data research is very important as well. So we've got to, effectively the when you do your research, the hypotheses people are testing, different aspects will be shaped by the context and the backgrounds each of us have. So we therefore need to have scientists who are representative of different groups, who are thinking in different ways, bringing them together and then stimulating the different research that comes out of it. Otherwise, we will just keep getting the same things coming out. So have we got the diversity of data scientists working on this, as well as the diversity of data and working on the diversity of hypotheses and things coming through that? So it's all of those combinations together. Yeah,
I think that's fascinating. I think it's maybe people have, well, I don't know, maybe have people woken up very late to the diversity of the problems of diversity of teams. I suppose I probably was unaware of that until too recently, but yeah, certainly reading about the problems that non-diverse teams have created has been an eye-opening experience for me for the last couple of years. Are you seeing specific examples where that is being addressed and changing?
Yeah, it's in terms of, well, first of all, starting off by being able to measure so if you take the data side of things, how we've got the diversity and representation on that. Well, starting off, well, can we even measure what do we mean by how? So if you take something like ethnicity, how are you seeing? Have you got a consistent way of measuring different groups of ethnic groups within the data? Therefore, can you tell whether you've even got kind of represented in there? Can we then be able to show across different data sets? So one of the things we're looking to do is actually start showing through, we have a gateway, which is a common portal for showing all the different data sets in there. Now we've got this common portal, can we actually then show the different, how representative, how different groups are represented within the data sets across that portal, so we can start measuring it. And measurement, as we all know, is a great way of starting to drive things forward and showing where we've got gaps and where the things are missing. We can then work out where do investments need to be happening, we're engaging funders. Are funders actually building this into what they're requiring? That then, so it's thinking through all of the incentive practices and that get the behavioral changes we're looking for. We're also then working on the, in terms of building the skills, we've been leading on a Black internship program. We've got 50 Black internships being offered this summer, so that we're actually bringing in new cadre of people into health data science. So we've got actually building out different expertise and different groups of people and coming together on that. And what we've been able to do is bring together different data custodians across the UK, so we can offer a fantastic portfolio of experiences for people coming into health data science, be it working in different disease groups, in British Heart Foundation activities, or be it working in a university. So really interesting, diverse areas that people can work in.
Oh, it's fantastic. Well, it's great to hear some leadership by example there, and I wish you luck with those endeavors. Well, that, Caroline, brings us to the end of our first segment. So thanks very much for answering the questions. But now I'd like to move on to a second section we do with our guests to find out what kind of things you're reading, watching, or listening to. What's on your reading and watching list?
Right. Well, I've got lots. So I love reading, and I think that's actually absolutely and fundamental to all the points we've just been talking through there, of really understanding other people and other perspectives. So I've got a fairly random collection of things that I'm going to bring in, but I would bring in, first of all, on watching, currently in the midst of Babylon Berlin, so a German program kind of series looking in the 1920s in Berlin, and all sorts of exciting things in that space. So happy to kind of talk about that. On a book, I'd bring in the Poisonwood Bible. And in another random aspect is surfing engineering department papers. So that's another particular pleasure I have. So, and just seeing new subjects. What are people studying? What are they working on at the moment?
All right, fantastic. What is the Poisonwood Bible? I've heard of that, but do not know it.
So the Poisonwood Bible is set in the Congo, and is all about a novel, so set over a period of several decades in terms of family moving over, a missionary family moving over to convert, and realizing that very quickly, learning a lot from the experience on that, and a pretty brutal experience while they had that out there.
I can imagine. Fantastic. Well, go check those out. The links to those below. I'm going to share a YouTube video I watched today. Caroline, are you familiar with Minecraft, Caroline?
Very well, via my kids at a distance.
Yeah. And are you familiar with the video game subworld of speedruns?
No.
Right. I'm not really, but there's this whole world of people who they take a video game and then they compete to create the world record going from start to completing games, right? And then, so video games that are intended to take 40, 60, 100 hours, they work out routes and glitches to do it in like 20 minutes or half an hour, right? So it's a whole competitive thing. There you go. Right. So now you know that. There's a very famous, I'd never heard of him until this morning, speedrunner who speedruns Minecraft, and he's got some of the world records. But boy, he was in a huge furore last November when people started accusing him of cheating in his speedruns for Minecraft by somehow modding the game. And people were, it's like all these things are appearing too commonly to be random. And so this furore has evolved in this massive
Sounds like quite an achievement, isn't it? Isn't that good if he's working out how to do?
Well, yeah, but then
He's playing the game very well.
Yeah, but he's cheating. Apparently, he's cheating in cheating. But what's happened in this controversy is there's now a weight of statistical analysis of all of his speed runs to try and work out, within the realms of Bayesian probabilities and all these other statistical methods, did he cheat or not? And so I watched this fantastic YouTube video this morning with all the statistical analysis of speed runs and Minecraft. Right, so I learned a bunch. It was an entertaining YouTube video, but it was also, it's amazing. It's like, how do you teach statistics to kids? My kids are homeschooling right now. They're not really very interested in statistics, but they do play Minecraft, so I'm going to maybe inspire them to watch that.
And was he cheating?
It turns out this YouTuber is a friend of this speedrunner, so he was very much on the fence.
That's you got to see behind it, all the statistics and things.
I know, yeah. So he stayed on the fence. Yeah. So anyway, the links to that will be below, and you can now got things to go watch, read, and listen to at your leisure. Everybody who's watching. All right, well, Caroline, that concludes our time. Thank you so much for your answers and for joining us today. Good luck with the work with HDR UK this year. Obviously, you're doing something pretty important for the good of the world. So best of luck. And to everybody watching, hope you've enjoyed. Let us know what you think in the comments. Click on the links below, and we will see you next time on If Data Could Talk. Take care.
Thanks. Bye.